Comprehensive Guide to Kienböck's Disease. The video is created by Dr. Abhinav Gupta and team. In this video we have covered everything about the topic from initiation to the end. Kienböck's disease, or avascular necrosis of the lunate, is a condition where the blood supply to the lunate bone in the wrist is compromised, leading to its gradual death and collapse. Causes of Kienböck's disease. The exact cause is not always clear, but potential factors include 1. Vascular insufficiency, reduced blood flow to the lunate. 2. Mechanical factors, repetitive trauma or abnormal loading on the wrist. 3. Genetics, some cases may have a genetic predisposition. Clinical features of Kienböck's disease. 1. Wrist pain, persistent pain in the affected wrist, exacerbated by movement or weight bearing. 2. Swelling, swelling around the wrist joint may be present. 3. Limited range of motion, reduced flexibility and movement in the wrist. 4. Weakness, grip strength may diminish as the condition progresses. 5. Tenderness, tenderness over the lunate bone. Diagnosis of Kienböck's disease. 1. Imaging studies, X-rays, CT scans, or MRI to visualize the bones and assess the blood supply to the lunate. 2. Wrist arthroscopy, direct visualization of the wrist joint through a tiny camera to confirm the diagnosis and assess the extent of damage. Treatment for Kienböck's disease. 1. Conservative management, immobilization, use of a splint or cast to immobilize the wrist and reduce stress on the lunate. Pain management, analgesics and anti-inflammatory medications. Activity modification, avoiding activities that may exacerbate symptoms. 2. Surgical options, revascularization, attempts to restore blood flow to the lunate. Lunate excision, removal of the damaged lunate bone. Proximal row carpectomy, PRC, removal of a row of bones proximal to the lunate. Joint fusion, fusion of adjacent bones to stabilize the wrist. 3. Joint replacement. In advanced cases, joint replacement, total wrist arthroplasty, may be considered. 4. Rehabilitation. Physical therapy to improve range of motion, strength, and functional use of the wrist after surgery. Occupational therapy to assist in adapting daily activities. The choice of treatment depends on the stage of the disease, severity of symptoms, and individual factors. Early diagnosis and intervention are crucial for better outcomes. Consultation with an orthopedic specialist is essential for accurate diagnosis and appropriate management of Kienböck's disease. Vote of thanks. Thank you for watching our video. We hope this information has been valuable to you. If you have any further questions or concerns, please consult our team for personalized advice.